actually long lever back lumbar manipulations. So also, these are highly effective and much for show, but above all, of great benefit. And as I always say, around this whole course here, these are manipulative treatments that will lead to have immediate effects, I repeat, which is what your patient will look for. That's why he comes to make these types of manipulations. Now I let, as always, Marco talk, who will explain to you, step by step, how to make this type of treatment.
Yes, so obviously I will teach you two dorso-lumbar manipulations, a long and a short lever manipulation. The first one, in fact, is inspired by the manipulation to treat the sacroiliac joint, which is called Chicago technique. Of course, then we will see also this manipulation. However, in this case, you'll indeed unlock with a long lever the lumbar spine part with this manipulation that I'm going to teach you. How is it done? Obviously, first you have to carry out the test on lumbar and back spinous processes. And I'm telling you right now, this is a manipulation that you can use in all those painful conditions that press a bit on the femoral nerve. So you know that the femoral nerve, of course, is the one that begins between L1, L2, L2, L3, L3, L4. Therefore, in case of crulalgia, you can use it. But don't worry, because now I'll explain it to you step by step in slow motion. Okay. So let's assume now that here you have the dysfunctions on the lumbar spine part that I've marked. So T10 and T11. In dysfunction on the right. And of course you will understand immediately what leg the patient has to overlap. It is the right one, exactly in this case, okay. Thus the positivity of the vertebrae when making the tests on the spinous processes already suggests which leg you want the patient to cross. You see, the patient is lying supine, of course. I'll ask him to cross the right on the left. In this way, I'll go right to place the hands, obviously low. It is right in slow motion to make you understand how to do it. You will ask him to cross the hands behind the head, after which you will position yourself contralateral to the dysfunction, which is on the right. So look, I'm moving myself to the left side of the cot.
Okay, Marco, so position the customer up to this point, we're okay, right? Once he has been positioned, crossed over, crossed his arms behind his head, what should we do?
So of course you have to place one hand, now you see it there in slow motion, right to show you the position, because one hand will be positioned behind the shoulder, okay?